Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have Dr. Rajalakshmi R. She is a renowned obstetrician gynecologist from Udupi and past president of IMA and the present president of Manipal OBG Gynec Society. More than that, she is a columnist and she is a person who is concerned about the society and the younger generation. So she goes to the schools and colleges to teach them about their healthy habits. And today she is here to talk to us about the cesarean section, because there is a section of people who always put in the minds of the society that the doctors are unnecessarily doing the cesarean section. But today she is here to clear the doubts in the minds. Welcome, Dr. Rajlakshmi.
Yeah. Namaste, madam. Thank you. Thank you for the opportunity.
Please tell us what is the cesarean section, how you do it, and what are the indications?
Yeah, surely, ma'am. So when a baby can't be delivered vaginally, we opt to take out the baby through putting an incision on the lower abdomen. And that procedure is called as cesarean section. So it is usually done under anesthesia. Usually we do under spinal anesthesia, where an anesthetic drug is injected into the spinal cord level. Yeah, to the back, at the lumbar level, low down. And the part below the waist will be not sensitive to pain. They might feel some movements, but pain will not be there. So usually spinal anesthesia is
awake. The patient is awake. She's looking around. Everything is there.
Yeah.
But she cannot move the legs.
Cannot feel the pain.
And
she can hear the baby's cry.
Yeah.
She can see the baby. She can hear the baby's cry. She can see the baby. She'll feel the process, but there won't be pain. But if the general condition of the mother is not well, like she's in some bleeding, antepartum bleeding, or severe hypertensive disorders of the pregnancy, then we might need to do cesarean under general anesthesia. That is very low chances. Usually we do under spinal anesthesia. And why do we do it? See, the problem, the indications can be due to a maternal condition or due to a fetal condition. In a mother, if there is a cephalopelvic disproportion, if the pelvic bones are very narrow and there is no enough space for the baby's head to pass through, we call it cephalopelvic disproportion. So maybe baby is big, like in case of some uncontrolled diabetes, or she's having uncontrolled hypertension, or if the placenta is lying low down in the pelvis,
placenta
previa, in the uterus, where we call it as placenta previa. Or if the mother has undergone any surgeries, maybe like fibroids she has removed, or there has been some Mullerian anomalies, her uterus has undergone previous surgeries, where we cannot give a chance of put too much pressure on the uterus.
When that strain is there,
it might
rupture or it may give up in that area.
So we will not go. And if it is a very short lady, if the height is 147, even her pelvis will be very narrow. And sometimes the shape of the pelvis, we have android, gynecoid pelvis. So if the shape of the pelvis is not proper, which is not fitting into the head is not fitting into the pelvis.
So the passage and the passenger both should be suitable and good. Optimal.
Then yes. And last but most important now, it is because if it was a previous cesarean delivery, they usually ask, is it a cesarean always? So if the cesarean was done for a non-recurrent cause, like the baby's heartbeat is sinking, baby's heartbeat variability is there, baby has passed motion, or baby was in a breech position, the leg low position, not the head. So that condition may not recur. So in that case, they can deliver normally in the second delivery. If it was for a recurrent condition, like her pelvis is contracted, there is no place there, or she has undergone some surgery for the uterus, where we can't take the risk of giving her the pains. So that time it will be a repeat cesarean section.
And if the mother has had pains for a day or 2 days and they said not progressing, then what do you do?
That is we call sometimes obstructed labor, because of the baby's head's position. It will be deflexed. The head has to be flexed Usually it comes the occiput, the back portion of the baby comes out first, but it can be a face presentation, it can be a brow presentation. So if there is a abnormal presentation, she gets pain, the cervix gets dilated, but there won't be a normal delivery. So that time also, that is called obstructed labor. That time also, that is a very difficult cesarean, second stage cesarean we
Yeah.
call, very difficult. So that
And
time also we have to
if
do
they force, the whole face will be mashed and the child will be grotesque look will be
bluish,
there, and the
and it'll
bluish
have a
color
big,
will be there. Big
yeah, it'll have a big
protruding.
head
Yeah.
will be prolonged, hematoma, like cephalematoma we call. Yeah.
Yeah.
So these are all the condition when we do a cesarean sections.
Okay.
Now,
Now, one question to you. What was
yeah,
the mortality rate before the cesarean section were there, and what is the rate now? The
there's
mother's
a lot of
mortality and
difference, ma'am.
the, yeah,
Yes,
yeah.
there's a lot of difference because mother would have died with the baby in utero that time. Even during
Hmm.
my PG days, I have seen that because that
Hmm.
time people were not agreeing for cesarean, thinking that like what you said, doctors are doing for their benefit. No,
Hmm.
because if there is as we mentioned, the passage and the passenger and the baby mother's condition, if it is not going well,
Hmm.
both can jeopardize their life. So
Hmm.
maternal mortality was also high. Babies used to be born with all the injuries and palsies. So better than that is cesarean section. After
Hmm.
the invent of cesarean section and antibiotic, the maternal mortality as well as the infantile mortality has come down drastically.
And also the stress and strain on the obstetrician, that also has
Yes,
come down.
come
Otherwise, the
down.
whole night they used to be sleepless and so much of stress, and it was a really
No,
harrowing time
no,
for
the
the obstetrician as
yeah,
well as the
stress is still
mother and the
there
father.
because we are
Yeah.
dealing with the two lives.
Two
So we are
lives.
under little
Yes.
stress, but we
Yes.
have methods to diagnose things now, like ultrasound, continuous fetal monitoring. All that helps us to make a faster diagnosis and
Yeah.
take action immediately
And
before
take
the
the
lady
decision.
lands up into, yeah, before the
Yeah.
lady lands up in problem or
So
complication.
before the era of ultrasound, our professors used to tell, a
Mm.
masterly inactivity and then
Then
taking the action. But
observing.
now, yeah, but now, and they used to say the obstetrician has got to no sleep, and then
No,
school
we
teacher
do.
has got
So
no
if
sleep. But
the
then,
process
yeah.
of if the process of labor is progressing normally, we have
Hmm,
a graph, we have
hmm,
a partogram. So we have
hmm.
to plot in that. If it's going very well, we still do masterly inactivity.
Wait.
But if there
Okay.
is a problem somewhere, something arises, we plunge
And
into action.
risk to the fetus or the mother or the
Yeah,
drop in the
mother,
blood
then we have
pressure.
to take.
Yes, you have to think.
Yeah, yeah.
Okay, and now you told the indications and you told how it
Mm.
is done. Now, let me know, are there any inherent complications of cesarean section?
Yes, cesarean section is a surgery. So surgery is always comes with some complication, not that every time
Yes.
they have to happen. So it can be some anesthetic complication or excessive bleeding, or there can be infection, or
Hmm.
there can be embolism,
Hmm.
thromboembolism. All these are there. We do
Hmm.
explain to the patient because it is a surgery. It comes
Hmm.
with certain amount of complication,
Yes.
but
Yes.
very rare. They usually don't happen.
Hmm.
Regularly,
Okay.
we won't see, but once in a while, they do happen.
Hmm.
Yes.
Okay.
We would also like to tell them, ma'am, there are some things like once, I already told you, once cesarean, always cesarean. Is it true? They ask.
No. No.
No, I already. Second one is what they do is once it's a cesarean, they think it is some major surgery and they make the patient lie down for months together. And
Hmm.
that causes thromboembolism sometimes.
Hmm.
So we request them to treat her as a normal delivered patient, give her proper food. There's no need to restrict. They restrict idli, vada, and all. Oh, that
Hmm.
black gram shouldn't be seen. No, nothing should be done like that. They
Hmm.
should walk around. They should be made ambulatory as soon as
As
possible.
fast as
Within
possible.
6 hours. Yeah, within six
Yeah.
hours. Within
Otherwise,
1 hour,
this deep vein thrombus, the clot in the legs, it will go into the lungs and cause the pulmonary embolism.
pulmonary
And
embolism.
the surgery is successful. The child is all right, and the mother will die with the
Yeah,
pulmonary embolism. Very
yes,
dangerous. Yes.
especially in a lady who is obese. So you have
Obese,
to be
yeah,
more careful. And
yes,
they should
yes.
start breastfeeding within 1 hour. And we advocate that they should sit and breastfeed. There won't be much problem. And they feel that they shouldn't take bath. Water will enter into their tissues. Nothing like that. We have sutured them very
Of
well.
course,
The only
infection
thing is,
has to be avoided, and because
yeah,
sepsis can
they have to
occur,
keep
and that also,
themselves
yeah,
clean and drink enough water also.
water.
They restrict water, that is not good. And some amount of activity, exercise after 6 weeks.
Yeah.
And about this maternity belt,
Mm,
whether it can be used. Yes,
mm.
in the beginning, maybe for 1 month, it will give them pain relief. It'll give them strength.
Yeah,
But
the belt
after
can
that,
be
they
added.
should,
Yes.
yeah, after that, it's better they exercise and build up their muscles. If they continue to use that maternity belt for long time, the muscles get loose
The
actually,
muscle
and
tone may
they,
not develop.
yeah,
Yes, yes,
it
yes.
will not come back. They will not get
Mm.
regain the muscle tone, and they might land up with
Okay,
pendulous abdomen. So all
okay.
these things about the
Yeah,
lifestyle after cesarean.
finally, I would like to ask, there are so many myths in the minds of the people. And what is
Mm.
the truth? Because always, the obstetricians are struggling. I mean, putting their heart and soul to save both the lives. But many a times the people mistake them. So, what is the truth and what is the myth?
Okay. We certainly agree that the cesarean section rates are increasing. It is because of the late age at marriage, at conception, more number of IVF conceptions, more number of precious pregnancies, and more number of multiple gestations. And when you conceive late, usually it
Mm,
is along with some comorbidities, or they develop some hypertension or diabetes during pregnancy. So
mm,
because of all these things, they land up with cesarean section. It is not that doctor wants to deliver only by cesarean section.
mm.
We have to consider both the mother and the fetus baby, and we see which is the best for the both of them. So
Okay.
unnecessary cesareans we won't do, because there is a cesarean section audit, and government asks us every month, we have to send them the report how many sections we have done cesarean, what was the reason. So we are all also under an audit system. It is just like that we can't do. Yes, public thinks that we do it for one money. No, because if we are doing a cesarean, we are giving a scarred uterus, and that will be for lifelong, so she can have problem later also. So we have to think about it and decide. So unnecessarily, none of the obstetrician will do a cesarean. It will be only for the benefit of mother and the child.
Yes. And public should realize that because they are getting married late, because they are coming late, and because they're obese, because they have got diabetes or hypertension, or they have used IVF to become pregnant and twin pregnancies, all these things are adding up for making the cesarean
Causes.
section more often. But they cannot blame the doctors for it. So the doctors, the obstetricians are trying their best only to help the baby and the mother. And this
Yes,
point
sure.
should go into the head of every person. And ultimately, the safety of the mother and the baby is our bounden duty of the doctors as well as the family members. So the
Yes,
society
sure,
should
ma'am.
understand the
Understand.
responsibility of
Yes.
both. So thank you very much, Raj Lakshmi, for explaining so beautifully about the cesarean section. Thank you.
Thank you, ma'am. Thank you so much for the opportunity.